Welcome everyone. We're gonna get started talking about remote neurofeedback, which is, a way to train your brain from home. So what does that mean and what does that look like? So here's our agenda for the day. We're going to go through a quick introduction. Go through what is neurofeedback, how it works, who can benefit, some of the risks and benefits, how we NeuroAxis do our remote neurofeedback program. We're going to go through brainwaves, talk about brainwaves, go through QEEG, what that is, how we use it to help us measure brainwaves and personalized neurofeedback. And if we have time, we'll go into a history case study and we'll make sure we get to questions at the end. So just a quick intro to me and Dr. Chung. So my name is Dr. Jessica Tolentino, and I've been working in the space of QEEG and neurofeedback for over 10 years now. It really has become my lifelong passion. Once I started working in it when I was an undergrad doing research. I've worked in psychology offices. I've worked in performance offices, and now I work here at NeuroAxis, where we see, a gambit of conditions from concussion, migraines, dizziness, vestibular issues. And the beautiful thing about neurofeedback is, how it can be applied in so many different cases and how it can really help people who are suffering. And so that's the real reason why I've been working at it for as long as I have, and why I'm so excited to be giving this presentation to you all today.
All right. Thank you, Dr. Tolentino. So I've been a chiropractor for 19 years now, but I've been in alternative medicine since I was 19 years of age, so about 30 years now. I got my start into alternative medicine as a semi-professional skateboarder in my youth and teens. I was supposed to go pro when I was 17. I was in international videos and magazines, and then I started getting some cumulative injuries and also began to question the longevity of the sport and going into alternative healthcare providers like chiropractic, physical therapy, and acupuncture really kind of inspired me into this mind-body kind of relationship that I was really interested in, learning more about myself and my growth. So I decided to quit skateboarding and take an adventure in learning about natural medicine and herbology, wild-acting plants in the wilderness, going through different university and alternative medicine programs, and eventually through chiropractic and functional neurology, and continuing the learning process, ever since, from chiropractic neurology, how to understand the brain and measure different functions, to quantitative EEG and brainwave analysis that we're going to get in today with neurofeedback and biofeedback strategies.
So I thought it'd be fun to start out with this is kind of some fun facts about the brain, or some myths that we're not falling for in 2026 when it comes to the brain. So a lot of people hear that, brains don't change. Once you are an adult, things just are the way they are no matter what, and you can't do anything about it. Well, by the end of this, I want to make you all feel empowered that that is not the case. You are stuck with the brain body symptoms that you have. Again, this goes along with the idea that brains don't change. With the right knowledge, with the right tools, with the right guidance, the brain, the body symptoms, they can shift, they can change. So you're never just stuck. Another fun fact, well, one that is often misconstrued, we only use 10% of our brain. So that is just absolutely false. We use all of our brain all of the time. Even when you're completely at rest, there's a whole network of your brain that's devoted to just being quote unquote off or at rest. So that is false. We cannot make new neurons. So a lot of people, again, hear that once you have all the neurons and all connections that you have as an adult, we can't make new ones. Again, that's just not true. With the correct stimulus, you can, in fact, make new neurons. And then this one, brain games will make me smarter or heal my brain. So you have a lot of those online, like cognitive games, cognitive brain training games online. People think they can play them and have their IQ change and have their cognition change, but those really don't transfer outside of the games themselves. So they make you really good at those brain games. So we're not gonna believe these myths. And why is that important? Brains are designed to change. you have the power to change things again with the right tools, with the right information, which we're trying to, give you in part during this webinar. Hope you realize that there is power to change things. We use all of our brains all of the time. So that's the whole study of the brain. And with EEG, you can see that there's activity all the time. We can make new neurons at all stages of life, given the right stimulus. And intention, strategy, and the right tools will make you smarter and help heal your brain. None of those online games. So the whole idea here is you should all feel empowered that there is something that we can do. So with this knowledge, let's go and try to apply it and see what we can achieve. So we're going to jump into what is neurofeedback. This is why we're all here today. So neurofeedback, another name for neurofeedback is EEG biofeedback. So it's the measurement and training of brain waves in real time using operant conditioning. I'm going to go into a little more detail later about what exactly those terms mean. But essentially, we're measuring brain waves in real time and providing the brain with audio, visual, or tactile feedback in order to self-regulate brain activity to promote relaxation, sleep, attention, and focus. It's a learning process where you learn how to shift and maintain mental emotional states. So when I say a learning process, it's like learning anything, learning how to write, learning how to ride a bike, learning how to speak a new language. It takes time, but once you learn it, you hold on to that knowledge and those skills. And rather than forcing the brain to change, neurofeedback teaches the nervous system new patterns over time, similar to physical training for the body. So again, with training, you can think of training in the gym, training for physical ability. You can also train your brain similarly. And it doesn't force the change in the brain, but your brain learns to adapt and shift on its own. So what does that look like? So this is just a general image to go over what biofeedback is as a whole. So biofeedback generally is when you take a normal biological or physical phenomena, if you are able to measure it and quantify it, put a number to it, then you can find things to change that number to make it either go up or down. And by doing so, this measurement and feedback process, you learn how to control whatever that biology is. That can apply to skin temperature, that can apply to HRV or heart rate, breathing rate, skin sweat. But in the case of neurofeedback, that's biofeedback on brain waves. So we're measuring something that the brain does, that the body does automatically, so produces electricity. We're able to measure that, quantify it, and then find ways to change those numbers, make them go up or down, to then shape and control and regain flexibility of that phenomena. So here's a quick video. Hopefully it'll play. This is what a session looks like. So it's really simple. Someone sits in a chair wearing a cap or placed electrodes on their scalp, and we're measuring the brain's activity moment to moment. And every time your brain or this person's brain does what we want, then there's an animation on the screen. In this case, they're fish swimming. So every time her brain, in this case, she was going for calm focus. So every time her brain is calm and focused, the fish appear on the screen. And every time she gets distracted or stressed, then the fishes stop and the sound stops. And that's neurofeedback. It's a really simple, comfortable process. So we talked about what neurofeedback is, but I want to go even deeper and talk about what good neurofeedback is. So these are all the gold standards you should be looking for when you're approaching neurofeedback. So first and foremost, good neurofeedback is data-driven. It uses QEEG analysis to guide the process. So QEEG stands for quantitative electroencephalography. It's a way to identify markers in the brain so that we actually know what we want to change using neurofeedback. Otherwise, you're just taking a shot in the dark. Good neurofeedback is long lasting. So because you're reinforcing the changes over time with multiple sessions, the effects cause what are called long-term potentiation in the brain, meaning that the changes that occur last even after the training is completed. So this is actually learning. Good neurofeedback is collaborative, so it requires constant communication and feedback about the effects between the trainer and the trainee. So whoever you're working with, you should be close communication with. We're talking about what you're experiencing, and they should be listening to you, adjusting things as needed. And it's constantly evolving. So regular updates to your protocols are made throughout the course of training based on the effects that you experience. So, what are brain waves? We keep talking about brain waves. What are these things? And how do we know what brain activity is good to reward? So, the brain is an electrical chemical organ. It works by the neurons communicating different information by sending electrical signals to communicate. And they send these electrical signals at different speeds. They can vary in speed from very, very slow to very, very fast. And each frequency communicates different types of information. So a similar analogy would be like radio stations. So you have different speeds or different numbers, different channels, and each channel on it carries its own set of information. So the brain is similar in that it oscillates at different speeds, with each speed carrying different kinds of information to communicate. We can measure those uh, electrical impulses when neurons are firing in synchrony. We can measure them at the scalp by putting a cap on your head. So EEG, or electroencephalography, is the measurement and the study of brain waves. The Q part, so quantitative EEG, that happens when we use digital analysis to separate brainwaves into their individual components to help us learn about their distribution throughout the brain. So these are just examples of different types of brain waves, ranging from really, really slow to really, really fast. One way to think about them is states of consciousness. So when you're at the slowest end of brain waves, you're in delta. That's often seen when we're really, really deep asleep. So not conscious, deep asleep. Then the next second slowest are theta waves. So these are still pretty slow. We make them when we're asleep or when we're just below consciousness. It's kind of like if you're watching a movie and you are kind of starting to fall asleep, your friend nudges you and is like, "Hey, what are you doing? You fell asleep." And you're like, "No, no, no, I was awake." Well, you may not have been fully asleep, but you weren't fully awake. And that's what that theta state is. And it's really important for visualization, memory retrieval, creativity, things like that. And then we have alpha waves. You can think of alpha waves as our idling speed of the brain. So when you're awake, conscious, at rest, not thinking, not processing, not stressed, you're just sitting there nice and relaxed, you're in that idling state, alpha. And then we get the faster waves when your brain is more active, when it's processing, when there are certain parts of your brain that are doing the task that they're responsible for. You're in beta or making more beta. And then the fastest, gamma, which is related to insight, peak experiences, consciousness, synchronization. That one is one that is very interesting when people are talking about states, understanding consciousness. It's a very interesting wave. But all of these waves, we make all of them all the time throughout the brain, and we can capture those using the quantitative EEG process. So why is that important? Why do we care about measuring these things? Well, symptoms happen when the brain loses flexibility and gets stuck in one type of brain state. So going back to that car analogy, you want the ability to shift up and down depending on the demands of, say, your car. If you need to go fast, you need to be able to shift up. But when you need to slow down, you should be able to shift down. But when you lose the flexibility, you might get stuck in neutral. You might get stuck in high gear. You That's when symptoms arise. So when you lose the flexibility to go in and out of these different brain waves. So QEG helps us to identify the states and where they're getting stuck. And then neurofeedback helps to unstick it. So it helps teach you how to regulate and maintain state appropriately. So what is QEG? So I'm going to pass this over to Dr. Chung.
All right. Okay. Dr. Tolentino, can you see my screen on your end as well?
I cannot. Let me stop my share. Okay, go ahead and you can share yours.
Okay. Okay. How about now?
Yes.
All right. So what is quantitative EEG? Well, as Dr. Leslie, as Dr. Tolentino has already said, quantitative EEG is a measurement of brain waves. And our process here starts with putting a full cap on your head with 20 sensors. And so you can see this on the image on the left with all these squiggly lines. These are 20 sensors, or 19 to be exact, and we're recording the brain waves in real time and then with your eyes open and closed. And to the right is when we do a software analysis where the quantitative EEG happens, where we're able to quantify, digitize, and differentiate how much of each of these brainwave frequencies are distributed along the head and brain. And this process to the right looks like a map like this. So now we're looking at the cap looking from the top down. So each box is a sensor on the cap. And now it's illustrating the different brainwave speeds or waves from slow to fast, left to right. So the red is the slowest, delta and theta, yellow's in the middle. So we can see that the top two boxes on the top are the front of the head, and the two boxes on the bottom are the back of the head. And of course, the ones on the left are along the temporal region on the left side, those three there, and the ones on the right side. Down below in the left-hand corner is something called Loretta, where we can actually look at specific sources from these waveforms, that predominant states of dysregulation. And we can do a two-dimensional source location where in the brain that this is occurring, similar to like an MRI, the physics equations that they use to identify the source from the surface of the head. And so quantitative EEG is measuring neurons, specifically the cortical neurons, which is the first few millimeters on the surface of the brain. You may have heard this as a cortical layer or gray matter or neocortex. That's where these cell bodies lie on that top surface of the brain. And these neurons are called pyramidal cells. And you can see these little red cells here with other connections that go down from underneath that layer. And we're measuring those directly. So those squiggly lines are from those electrical potentials, that communication that's being occurring in real time. But it's also relevant to the connections they have as a network from areas underneath those, related to many different processes. In medical science, EEG is still used for screening for seizures and management of it, for significant or severe changes in consciousness and other kinds of disorders of consciousness. In a sleep lab, they'll measure your brain waves to directly measure your stages of sleep. But most regular imaging studies like MRI have replaced the use for things like tumors and other things like that. But from a quantitative perspective, we're looking at real-time function and gather much more information about one's brain. So this is the cap that we use. You can measure brain waves in real time. And I was telling you about these electrical potentials or field that we're recording from the surface of the head, and they're reflected from those connections below that top surface layer, that cortical neuron layer. And there are connections to these pathways or like relay stations or highway stations that are communicating all sorts of sensory information to the brain. And this is all the distributions. If you imagine the top surface layer of the cortex I was just showing an image of, that's on the top right here, just above all these colored lines. And then the connecting pathways from those cells to the middle of the brain, where you see it kind of funnel down in a circle. That's called the thalamus. The thalamus is your brain's major relay station that all sensory input goes into. And then, of course, you're not perceiving all the sensory input at any given time. Your brain filters it. It adapts it based off of what you're attending to or what you're trying to do. And so if you're focusing on your body, you're activating those pathways, like in the green ones, to sense and feel and be aware of your body. If you're activating the ones in the red, that's through the visual and sensory systems. So you're more aware of your environment and your internal sense of self on the back half of the brain. And in the front, in the blue section, more towards cognitive and mood regulation symptoms in the frontal lobe. So all these pathways are relaying through this area called the thalamus, what we call the thalamocortical system. And so we're directly measuring this with EEG and QEEG. And this represents a broader perspective that when we're talking about states that we're getting stuck in or we want to shift into or have a dynamic ability to shift into appropriate states, this is called the triple network. Nope. So the triple network, lost some of the details in here. The one on the left here in red is called the default mode network. This is when you're idling in a relaxed state. Your eyes are closed, you're kind of sensing your internal self and your thoughts are wandering and you're relaxed. The switch in the middle is called the salience network in yellow. This is where the temporal regions, we're looking from the top down. The temporal regions is a multisensory area of vision and sound and input from your body and inner ear and all your organs in your body. You're sensing these from both sides of your brain as you are attending to something in your environment, like you're watching TV. You're looking at something visual, you're paying attention to what you're processing through your sensory systems. That's called the salience network. It's also called the distress network because if you get stressed and you're focusing on a symptom because there's some kind of dysregulation occurring that's either causing chronic pain or anxiety, then you get stuck in this particular distress system. And if you're really focusing more in a cognitive, what we call executive network, you go to the right. So it looks kind of similar, but you're a little bit about doing multi-processing of perceptual aspects in the back and in the bottom part in the blue, and also cognitively up front when you're thinking and strategizing. So that's called the triple network. So when we get stuck in symptoms, we may be stuck in the left side in a default mode where we kind of too drowsy, not fully awake, always groggy, or maybe we're stuck in the middle where we're kind of perseverating, we can't stop thinking, our mind is racing, or something's really bothering us, or have difficulty just kind of not thinking about work at the end of the day, or executive functions. You really have a hard time sustained with attention and concentrative tasks. So there are biomarkers which we can identify, which are patterns of brain waves. And these represent specific symptoms and conditions. We're not going to go over these in extensive list in detail, but what this slide is to illustrate that there are very specific patterns that inform us about these different injuries or symptoms. For example, brain injuries will often have a combination of areas that have been injured structurally, so they show up as very slow wave activity, but also mixed with areas that are hyperactive or irritated, very fast and spiky areas. That could be due to compensation, due to the areas that are slow, or other areas that are causing distress, like anxiety and things like that. And migraines are usually typical of people that have a very busy brain or sometimes a fast brain. The default speed is a little fast, but they get stuck in this overengaged mode, and this creates a passing threshold of stress or fatigue, and then you get a threshold of migraines and vascular changes relating to headaches. That's one major aspect. Anxiety also end up like a very hypervigilant or aroused brain. That's a hard time really relaxing, and that will show up in a variety of different features. Depression, oftentimes we'll see asymmetries in the frontal region, and also sometimes mixed in with maybe other post-traumatic stress markers and anxiety, because oftentimes you might have a mixture of both. And post-traumatic stress, similar to what I mentioned, there's other aspects in the back half and front half of our brain where we might be very sensitive to sensory stimuli and particular triggers in our environment or social situations. These are biomarkers that are showing us about these different patterns and how we can personalize neurofeedback strategies to help relaxation, focus, and shifting states. So this is one map that's called a quantitative normative map, or database map, normative database, sorry. And a normative database map is where we upload the data, and a system is created that creates a normative database that we're comparing your brain to a database of what is normal for people who don't have specific diagnosis of conditions. So what is a normal range? And the colors would show up differently, that if areas were too increased in slow activity, like on the ones on the left of delta and theta, then we'd see more red or yellow. And if things are under what they should be, they would show up as blue. And these here, they all look green because they're all within normal range. Well, this is like a Goldilocks. It's like not too little, not too much. You're just right in the middle. Now, this is not typical of most of us because we all have different strengths and weaknesses, and we all have predispositions to being more anxious, or hyper-focused, or a combination of a lot of different things. We like to take it a step further and do other manual processing to get more detail, like I showed you in the previous maps. So that goes to, who can benefit from neurofeedback? So neurofeedback can really help anybody with a brain. If you're seeking to optimize brain health and wellness, or focus on states of meditation or relaxation. Now, it's very important that there's been a whole thousands of published and peer-reviewed research articles over the history of neurofeedback with helping with lots of different conditions and symptoms. Now, with that being said, it's important to know what the FDA only clears the medical devices, the amplifiers specifically, for relaxation training in neurofeedback. Now, that's despite all the literature that's been published over the years that can help with all these different conditions. And what that means is that over the last 2 to 3 decades, there's all this evidence-based support being able to indicate that neurofeedback can help with attention and impulse control, like in ADHD, and compared just as equally to medication, but often have lasting effects because it trains the brain instead of just helps symptomatically with being more attentive. There's research showing that it can help with chronic stress and anxiety by helping one relax and calm and support mood. It can help decrease the severity and frequency of migraines and headaches, and support cognitive function like focus and concentration, and emotional stability following concussion or traumatic brain injury, and a whole host of other conditions. My last presentation, I did one on Parkinson's, on neurofeedback and biofeedback strategies in the literature that have shown to help with stiffness and movement and gait, and many other aspects of the non-motor symptoms. This is all in the context of research been supported with neurofeedback and biofeedback. Now, to be clear, that means neurofeedback is not a treatment. It is a brain health and wellness tool to help with relaxation. But we use the evidence base to customize protocols specific to one's needs to help them within that context of helping train brain health and wellness. So it's a F10 FDA cleared device for relaxation training. And because of that designation, most insurance payers often don't cover or reimburse for it. It's still considered either investigational or not medically necessary at the time. These services are not a substitute for medical or mental health care, not presented as a treatment for specific psychiatric diagnoses. So, like I said, we use the evidence-based throughout the history of neurofeedback to guide and personalize training. And that goal is to help with relaxation, attention, self-regulation, and cognitive performance. So in chiropractic neurology and brain health, as I'm a board certified chiropractic neurologist and licensed QEEG diplomate, my focus is on evaluating and supporting the brain and nervous system function within the scope of chiropractic practice. So we do not diagnose or treat mental health conditions. So when neurofeedback may be helpful for individuals with anxiety or other mental health conditions or something else, then it's important that you stay within that care with that health professional and continue it. With that said, we receive numerous medical referrals all the time for our expertise in brain health and wellness and chiropractic neurology services. So we work with psychiatry, psychology, neurology, and primary care on a regular basis, particularly for complex cases that need a multi-integrative team to work on all facets. So our role is to provide the adjunctive brain training and wellness service to improve self-regulation and functional outcomes. So, what might be the side effects? There isn't any therapy out there that might have a side effect. You get a massage, your muscles might be sore. If you exercise, you might injure a joint, and things like that. So we'll discuss some potential side effects with neurofeedback. So while rare, the most common side effects are headaches, fatigue, irritability or anxiousness, and symptom fluctuations of what you've been experiencing. These are often very temporary or transient. They can be lasting from minutes to hours, maybe a few days at most, in most cases. So, and the protocols can be adjusted to help minimize any potential side effects, either based off of where we're training, or particularly starting with the threshold, how hard we're having the brain work during the training. We want to start somebody off nice and slow, let their brain adapt so they get used to being able to change states of relaxation or focus, and gradually modify the length and time of training, or maybe adjusting where we're training in a slightly different way. So to date, there are no well-documented case reports or controlled studies describing permanent neurological injury attributable to EEG, biofeedback, or neurofeedback. So what is remote neurofeedback? So similar to the image that we saw here, we collect your data. Sometimes we can use an entire cap for training, but oftentimes we're just using a few sensors in the targeted areas that we identified in your quantitative EEG to train with. The remote system is on the right. This is a very easy and portable system where you have this cap on the head and you snap on sensors that don't need any gel or paste, and it wirelessly connects to any cell phone or tablet. And so you can train on the go or at home anywhere in the world you are. So in the office, we use the 510 FDA cleared devices for relaxation training and neurofeedback personalized to you. And for remote neurofeedback, these are non-FDA cleared, which just simply means it hasn't gone through that particular clearance. But so it's more on the guise of general wellness and brain training. What's really important to know is that we've spent years doing remote neurofeedback with different systems. In the beginning, I used remote laptops and hardware and software and wires and paste that people had to use and set up. And it was very technical and it wasn't great for a lot of people to work with. And it's not very portable. So we finally found a device that, like I showed you, is very portable and easy to set up. Almost anybody can do it. And we have compared the results from in-office training with the equipment we have here to the remote. And we find comparable results all the time. We've trained in the last year almost at least 50 people, gradually ramping up all sorts of different kind of symptom profiles, and had amazing results, which is why we're continuing to present this today and ramp things up. So our process for the remote neurofeedback is very extensive because it's a doctor-supervised brain health and wellness program, meaning that if you see and consult us, we have different levels of evaluation depending on what we're working with and trying to help support you with. So we start everybody with a comprehensive health history at the top left, and then going to the right in that top row, we then go do a physical and neurological examination because we want to test to make sure, is there any other contributing factors, how you process vision or balance or experiencing chronic pain, to know what else might be contributing to your brain state, and also what might be needed to be treated or addressed from that perspective as well, with either rehab or other diagnostic tests that you might need to make sure that neurofeedback is the right tool for you and be able to have a reliable outcome with it. So from there, we do a neurocognitive assessment where we're measuring different aspects of memory, visual and verbal memory, attention, multitasking, and comparing your brain to a normative database. So now we're looking at physical and neurological testing from all of your sensory systems in your body to your cognitive functions. And then we do a brainwave analysis with the EEG. And if there's significant dysregulations that are present in the EEG, we'll have the option to refer out to a medical epileptologist. Well, they'll do a review of your data, which is why we record at least 20 minutes, both eyes closed and eyes open total so that we can have a medical neurologist review the data if needed. And some people just opt in to want to do that anyway. We then manually process the QEG like we showed you in that step. And then we identify what is your particular phenotype of your brainwave patterns. Now, phenotype, there was called an article called Transcending the DSM with EEG Phenotypes by Jay Gunkelman. And Jay Gunkelman is one of the founders in the field of quantitative EEG and neurofeedback. He is Dr. Tolentino's and I's direct mentor, and he is one of the most wonderful, heartfelt persons I've ever met. And we review a large amount of our cases with him on a regular basis. And so he wrote this article where there are these very repeatable patterns that are stable that represent one's particular physiological trait, meaning that it's kind of like the transition between genetic expression and behavior. So these particular patterns of that we were showing earlier, they have a particular type. Some people might be fast or show this pattern of dysregulation. And this helps predict whether you'll be a better responder to specific medications and or specific kinds of neurofeedback protocols. So we want to correlate those findings with your symptoms and then personalize your protocols from there, and then start to do a 2 or 4 month remote training program. At the end of the course of a remote training program, we want to repeat the brain map and QEG process, repeat the cognitive testing, and then compare those results. And along the way, we've been tracking and monitoring your symptoms with questionnaires that you have to fill out on a regular basis every day you train. And then we check in with you every 2 weeks. We modify protocols and training thresholds throughout the entire time so that we're monitoring and tracking you and supporting you every step of the way. And when we mean also by doctor supervised, in the state of California here, we get to additionally consult you related to nutrition and lifestyle aspects related to supporting your brain, but also other aspects of health, because your brain is physiological. You need the right nutrients so you have the energy to be able to train and respond. So we'll talk about a whole host of things, all based off of your own history and what's going on with you, so we can help problem solve, help with referrals or other things along the process. So once we do our final review, we of course make additional future plans and help you support your brain health goals at that time. All right, so how does neurofeedback work? Dr. Tolentino. I'll stop my screen share.
Great. Yeah, so I'll take over from here, but really fast before I jump into that, I wanted to remind everyone that if you're interested or curious to hear more about your specific case, or if you want to learn if you would be a good candidate for this program, we do offer free 15-minute phone consultations that we'd be happy to schedule with you. So if you're interested, you can private message us, email us, call us, and we'll be happy to schedule that. Going into how does neurofeedback work? So we're going to dive into a little kind of backstory. And it all goes back to Skinner. So Skinner was a researcher working with pigeons back in the day. And he was studying something called operant conditioning. And operant conditioning is essentially a learning mechanism that neurofeedback, that's what it's using to essentially change the brain. So operant conditioning is learning by experiencing the consequences of our actions. If a behavior leads to a reward, we're more likely to do that behavior again. But if it leads to a punishment, we're less likely to repeat it. So in the case of Skinner and his pigeons, he was trying to teach them how to peck a bar in order to turn on a light. So essentially, he would notice every once in a while, the pigeons would naturally peck the bar, whether it was curiosity or whatever reason. And he noticed if he gave the pigeon food every time they pecked the bar, they would increase that behavior. So in doing this repetitive reinforcement or behavior followed by a reward, he was able to train these pigeons to turn on a light. He was actually able to teach them all kinds of different things that are much more complicated than just turning on a light using operant conditioning. Dr. Chung was telling me he somehow taught them how to play soccer or something like that. So, but fundamentally, it's a really foundational mechanism that all of our brains have the ability to use. So another example that a lot of people are familiar with is teaching a dog how to sit. So every time a dog sits, and that's a natural behavior, if you give it a treat or positive reinforcement, then it's more likely to sit again. And it's going to learn, oh, if I sit, I get a treat, so let me sit more. Another example of operant conditioning is if a teenager stays out past curfew and loses video game time, that's what we call a negative punishment, then they're less likely to break curfew again. So it's again about behavior and consequence. But how does a brain experience consequences of its actions? So I'm going to go into another analogy here with going back to that dog analogy. So if a dog sits and it gets a treat, then it's more likely to sit again. But what if, for example, we're now comparing that to a brain. So if a brain produces activity that we want, for example, if it makes brain waves that we know that are associated with calmness or with focus, and we give the brain a reward, then it's more likely to produce that activity again. But what if you couldn't see when a dog was sitting? That's kind of the situation with our brains. Our brains are constantly in flux, switching between states of calm focus, states of stress, states of distraction, whatever it may be. And those are all reflected in brain waves. So, as of right now, our brain's just at rest. It's like you're looking to train a dog, but you can't tell when that dog is sitting. So, what do we do about that? So what if you put a window into that room where the dog is, if you don't know if it's sitting, if you put a window in, you can see when it's sitting, right? It was kind of the same thing that we're doing with the cap. So the cap acts as the window into our brains and gives us the ability to see what activity is being made. So using the analogy, if you have a window into the room, you can see when the dog is sitting, and then you can give it the reward. So in this case, instead of a treat, we're giving the brain audio and visual feedback. So whenever the brain is, say, calm and focused, then the brain gets audio and visual feedback on a screen. And that is how it learns about consequences of its own behavior and then adjusts and self-regulates. So why does that work though? So we know that dogs find treats rewarding, they're yummy. But why do brains find audio, visual, or tactile feedback rewarding? Well, it's because it's a very fundamental fact that brains find all sensory information rewarding as long as it's not painful or scary. So our brains prefer a bright room to a dark room. It prefers more action in the environment as opposed to just a dull, dark room. The brain lights up when it sees those things. So in that same way, when you give the brain sensory feedback, or say you're training and you're looking at a phone, if more stuff happens on the phone when you make the brainwaves that we want, then you can shape that behavior and the brain will adjust itself. So I'm going to pass it back to Dr. Chung for a case study.
All right. Okay. So here we have a 26-year-old female with vestibular migraines and obsessive compulsive disorder. She had been through at least 2 inpatient programs and outpatient management program, been managed very closely with therapists and psychiatrists and other primary care. She came to us because she was having really issues with the vestibular migraine component. And vestibular migraine means that it's not really classic migraine where you get severe debilitating headaches that are throbbing with light sensitivity, but they're still related in the sense that it's not the headache, it's the sensory processing that's the problem. Vision, bright lights, loud sounds, visual motion around one's environment, triggering profound dizziness, unsteadiness. So she needed some rehabilitation, but the quantitative EEG that we're going to look at really illustrates how these two conditions were intertwined. Her physical symptoms of dizziness and unsteadiness was tied into her OCD and anxiety. And what we're looking at is the big squiggly lines from the raw EEG, and I put a box around these ones in the middle. I know It takes a while to train one, even professionally, about how to read the raw signals versus the quantitative map. But you need to be able to understand both to one accurately to figure out what is really happening. And the ones that I have boxed in here are these sharp and slow features on the left side of the temple. These here, this line on the bottom one is called CZ in the bottom part of the box. The one on the top is called T7, which is along the left temporal area. When these little waveforms, these little spike features, now these compared to the one on the bottom are facing the opposite directions. These are called out of phase. If they're both little triangle peaks are lined up and you can just overlap them perfectly, then these would be in phase. So when they have a phase reversal, it means the source of that signal is in between those two sensors, from the top of the head to the left temporal. Deep in between there, within the temporal lobe, is an area called the insula. The insula cortex, or this sharp and slow feature here, this is an article from Niedermeyer that shows that it represents a feature that's not necessarily pathological. It's a very finding that could be fairly common, but particularly common in symptomatic individuals, that these areas of the brain can be either irritative or ischemic. Ischemic meaning lack of blood flow. And what is a migraine? You hear about changing of blood flow areas or neurons that are hyperexcitable, so sensitive to sound and other types of sensory input, triggering a cascade of symptoms related to dizziness or migraine, and it can tie to other features. So it's referenced in the EEG literature, and then quantitative EEG in other ways that we can illustrate, like right here. I showed you before on the quantitative map process, the map on the right, we're looking from the top down. So the forehead is above, the back of the head is below, and each box represents a sensor and illustrates the brainwave slow to fast, left to right. Without going in exhaustive detail, the really point here is like, well, what are the symptoms and what are the specific findings? What we see that there's those little spiky features that are sharp and slow on the left that I showed you in the squiggly lines are represented right here. Now, they don't look very big, which is why you need to be able to have multiple ways of analyzing the data to confirm what is what. But these are bigger, these yellow peaks are bigger than the ones on the right. And the source between the center and the far left is between the two is the source. And this is the source of where a lot of migraines and a lot of people's symptoms come from when it talks about brain fog and dizziness and difficulty with thinking on the left side of the brain and words and language for the left side versus the right side being more social, emotional, and more global processing and mood and regulation of those kind of functions. But we can look at a two-dimensional source. This actually is a typo in the green. It should be just Loretta without an S. But this looks at the deeper source. So the images of the brain here in red and gray. We're looking on the far left one, looking from the top down again. So the left is has this big red area. Now, red doesn't mean that's severe. So it's very confusing when we look at different kinds of maps and what colors we're supposed to illustrate. We're looking at the source of those little wavy lines. So deep in the temporal lobe is this little white section here with the red in the middle. That's called the insula. It's a multisensory hub that processes all sensory input related to body input, inner ear related to head motion, called the vestibular system, visual motion, and all of your organ information, like your gut and your heart rate. And it controls your autonomic nervous system in response to what you're processing or doing in the environment. If you're cold outside, then you're going to constrict your blood vessels. If you're stressed, you're going to start increasing your heart rate. So the insula, when it becomes dysregulated, especially on the left side, you get prone to a sympathetic activation. Your fight-flight system kicks in, and it's often more associated with anxiety because of that relationship. And we can see and just confirm that that was the source. And the little dot towards the front of the head is called the anterior cingulate. Remember I showed you that triple network and talked about brain states? And we had one that was relaxed in default mode, salience or distress mode when we're activated, focus on something or distress on something. That is what I'm focusing on, is seeing now is this distress network, hyper focused on something that is occurring that's becoming problematic, vision and vestibular input causing dizziness and anxiety. So we can tell that these are overlapping where the signals are coming from. The insula is the hub that I described, is on the left temporal area here. If we lift up the nostril surface area, there's a cortical layer called the insula, and illustrated here. There's a back and a front portion. So that's what it looks like, and that's where those brainwave signals are coming from. And so we're directly confirming that, knowing where the source is, and now we can, well, how do we help this with neurofeedback, relaxation training, and helping shifting of attention of focus and states. So for this individual, we did neuromodulation support because they were here in San Francisco to come into the office. So we did some neuromodulation components, meaning that we can use infrared light for around the sinus and jaw and neck area that are a big contributing factor to migraines. So we can help shift and abort symptoms. And then we use neurofeedback and biofeedback. And when I keep on using those terms almost interchangeably, neurofeedback and biofeedback, neurofeedback is one type of biofeedback. The other kinds measure heart rate and heart rate variability, the time between heartbeats, which reflects your parasympathetic nervous system. That part of your autonomic nervous system that allows you to relax and slow down your heart rate, slow down your breathing rate, and synchronize your breath so then that can become coherent and relaxed and improve blood flow. You can also have other sensors that measure skin sweat, which is a sympathetic response related to fight or flight. You can measure breathing patterns, muscle tension patterns, and then you can train them with biofeedback training as well. So they did home biofeedback training for heart rate variability, which is essentially breath training with a sensor to make sure they're in a really good zone, getting a positive effect, and then complemented that with neurofeedback. Because they're also coming to the office for rehabilitation because they're having dizziness and imbalance. We worked on eye movement training, balance training, other sensory integration so that brain could begin to figure out or get used to processing information from their environment and their body more efficiently. When you combine these two strategies or all these strategies together, you get a really robust effect because you're supporting how the brain and the body are processing information together and being able to support that communication and strengthen it with each strategy. There's also some supplements that we use to help with inflammation and energy support, some very basic stuff for that individual. So this is a follow-up study. This compares the pre and post results. So anything, this is again a cap, an illustration of the cap, and each box representing a sensor. And everything below this horizontal line, these waveforms illustrated in the color, below the horizontal line has decreased from the previous recording. So remember we saw those things, those yellow peaks on the left that were out of sync or just asymmetric. Now they're decreased, meaning that they've significantly improved from the previous recording. There's also decreased in a lot of hyperactivity in blue. It's harder to see the faster signals because you have to zoom in a lot, but they're certainly there with so this is what it looks like without the comparison, the follow-up. There's more symmetry between both sides, and there's less hyperactivity in blue. But most importantly, what did this individual experience? They were not able to go to work as a teacher because of the loud sounds and environment of children, and now they're able to go back to work. They don't have any more dizziness, and she didn't resolve her OCD. She wasn't cured of her OCD, but she was able to manage and shift state more easily throughout the day and not get stuck and ramp up into this anxious cycle that would trigger the migraines and dizziness. So she had more control, more agency, and I haven't seen her in at least a couple years. So occasionally people need maintenance when they need more support if they kind of start to fall out of sync again due to other factors in their life or health. So I want to take another opportunity before Dr. Tolentino jumps in to review the how neurofeedback was discovered. Do you have any specific questions for us about what might be going on for a particular symptom or question about neurofeedback that we've covered so far before we go into more depth?
Yeah, I actually don't think we have enough time to get into the history.
Oh,
Just
right, it's 6 o'clock.
it's already six, but if you guys are interested, we'll be happy to do another presentation and get into that some more. I find it really interesting. It was actually the story is how it was discovered on cats. Um, so it's kind of interesting. But um, we'll just go ahead and I do want to leave you guys with some resources for if you guys are interested in learning a little bit more about some of the literature that exists. I wanted to point you in the direction of this one website. Let me share my screen. And this is through the ISNR, so the International Society for Neurofeedback and Research. So they have a comprehensive bibliography on their website that's been put together, has all of the research from over the years. Um, and there's research in support related to all of these things listed on this screen. So if you have any specific interests, you can go check out their website and you can see what papers and literature there is for whatever thing that you're particularly interested in. Another thing you can do is reach out to us if you want a free 15-minute phone consultation to discuss any of your own personal symptoms or those of a loved one. We're happy to be, um, happy to support you, happy to be a resource for you. So feel free to reach out anytime. You can call us, email us, text us, and we'll be happy to set that up.
Dr. Tolentino, can you share that last slide with our contact information?
Yes.
So any of you can take a photo, a snapshot of our contact information if you'd like to schedule a free 15-minute phone consultation. Happy to do that.
Here you go.
Thank you for coming today. We really appreciate it to share and spread the word, to learn more about how neurofeedback can help promote brain health and wellness and help in so many facets of one's life. So please share with any friend or loved one. We're going to send the recording out and you can share it with whomever you like. Look forward to connecting with you.